So I am very pleased to announce that with these promising trends, we are in a position to safely move to step 2 of our path back to normal and remove the vast majority of remaining public health measures in Alberta. Minister Copping will provide additional details, but beginning on March the 1st, that is to say effective 11:59 p.m. on February 28th, good thing it's not a leap year, we will end the provincial mask mandate through, though masking will still be required in higher risk settings, including public transit, Alberta Health Services operated facilities like this hospital, and continuing care settings, nursing homes across the province. We will also remove all capacity limits for venues. We will end restrictions on interactive activities, on liquor service and operating hours for our bars and restaurants and hospitality venues. We'll remove all social gathering limits. We will lift remaining school requirements, and we'll end health screening before youth activities, which is the only remaining measure applied to children and teenagers. We will also lift the mandatory work from home order, and let me say that's going to be great news for the downtown cores in our 2 big cities as workers come back to their offices. I know there are some who greet the lifting of restrictions with some mixed emotions, but I want to remind you, Alberta is not alone in this approach. In fact, places around the world and across Canada have begun their transition to the endemic state and have lifted measures as their Omicron wave subsides. And let me just say about that, we keep a close eye on what's happening right around the world. England, Ireland, Scandinavia, several European countries, South Africa, many U.S. states that got hit by the Omicron wave weeks before Alberta have also lifted restrictions, and so we can see what impact they've had, and the impact is very encouraging. Their numbers and hospitalizations around the world have continued to decline weeks after lifting restrictions. So I think we can move forward with confidence based on not only our experience here, but around the world. What we're seeing in the areas that are a few weeks ahead of us, as I say, including the UK, is that the relaxation of measures is not leading to a rise in new cases and is not overwhelming hospitals. This is good news as we move to lift almost all restrictions in Alberta this week. And I'd like to ask all Albertans to be patient with one another as we transition out of the pandemic mode we've been in for nearly 2 years. There will be some who will choose to wear a mask or who make choices about their activities based on their own personal risk assessment, and we need to respect those choices, the choices that individuals make. I realize it's difficult to shift a point of view and contemplate the future when so much of the past 2 years has taught us uncertainty, but we just cannot continue to live our lives indefinitely with restrictions on our rights and freedoms, on our normal lives, and with all of the negative consequences that those things bring for mental health, for people's financial well-being, for our life together as communities. We are social creatures. We are designed to interact with each other, to see each other's faces, to be community, to be close to one another. And let us embrace that normalcy as we are able to lift these restrictions safely. And indeed, with such high rates of vaccination and more effective new treatments coming on board, we shouldn't have to be concerned. We will be cautious, and we will continue closely to monitor trends in the future. But the path forward will be based on more and more people choosing the safe and effective protection of vaccines, as well as a growing number of treatments that are being approved and will be widely available. So if you are still unvaccinated or not yet fully vaccinated, or haven't yet gotten around to your booster shot, I just strongly encourage you to do so, not only to ensure that you stay healthy, but also because it helps us protect our hospitals from potential future waves. And just a little note on that, I know there's a lot of scuttlebutt out there that the vaccines aren't really working. Well, it's true that they're less effective at preventing infection than earlier because they've had a waning effect and this Omicron thing is more transmissible, but they are still incredibly effective at preventing the kind of severe outcomes that land people in hospitals like this one in Grand Prairie.